contracted employees. We have an increase of 30 million as compared to last year contracted employees, and an increase of 26 on the staffing details. Could the Honourable Minister say what is the designation of these new contracted employees and the wages for just the two top?
Yes, we definitely can. Okay, we have here the increase in budget for 2014 reflects 26 appointments of 3 store clerks, clerk 1, 4 storekeepers, class 1, 1 health economist, 4 accountant clerks, 1 research officer, 3 clerks general, 2 bond clerks, 1 analytics scientific officer, 1 office assistant, 2 admin assistants, 1 confidential secretary, 3 stores attendants, 5 drivers, and this includes the 5% increase that was given. I'm going to try to give you the data now on who gets the most pay.
Just the two top. Just the two
Top 5. Got that? Okay, we have the permanent secretary at the cost of $566,428 and some small allowances. Then we have the interministerial sector coordinator, $253,575.
Mr. Chairman, I was only interested in those that are employed now. The newly employed, that increase from 26, the highest paid, the increase from 26.
Okay, we have the health economist at the cost of $211,982. Right? And we're going to locate for you one of the newly, not a newly, 167,385 for an analytical scientific officer.
Mr. Chairman, just for my information, could the Honourable Minister say this health economist, is it a new specialty or?
No, health economist is not a new specialty. Unfortunately, there's a third of health economists in Guyana. It's something new here because we now get in there. As a matter of fact, we're happy to note that there's several new health economists, and new economists rather, in the health sector. Previously, we had 1 only at the HSD. So, health economist is not a new specialty. It's been around. It's just one of the things that we weren't getting around to, and there are not many.
I could ask the minister whether he can indicate whether the person is actually formally trained in that area, or it's an economist that they've recruited to fulfill a function.
He is an economist with some additional training in international relations, but we do have but he's fulfilling the functions of this position, Mr. Greenwich. But as you would appreciate, there's a third of this specialty right across the global scale.
Once again, in staffing details, Mr. Chairman, code 6111, there's an increase of 4 administrative employees and an increase of 7 million for wages. Could the Honourable Minister say what are the designation and wages of these?
Okay, that is, we have an increase in this budget because of it reflects the appointment of 2 staff, 1 accountant, an electrician, and a promotion of 2. That is the CMO and the Director of Planning, and also the 5% increase in salaries for the entire group of 4.
Mr. Chairman, could the Honourable Minister say if we hadn't a CFO before?
No, we didn't have a CMO.
Okay.
So no, to be more expansive, we had an acting CMO, but
Okay.
we just took it by, he was acting out of another position.
Mr. Chairman, under line item 6281, security service. Could the Honorable Minister explain the $10 million increase as compared to last year's budget, revised budget?
Okay, as you would know, there has been some intervention from the senior level, the Minister of Labor, indicating that minimum wage regulations must be observed, and apparently those regulations are being more vigorously enforced. The Minister of Health has come to know about it, and we've taken remedial action to ensure that these things are done correctly and consistently.
Thank you, Dr. Norman. Other members, I would like to put a question, and that is that we approve the current expenditures for program, for program 471, Ministry Administration. Those in favor say aye. Aye. Those against say no. The ayes have it. These form part of the estimates. Turn your attention, please, to page 443. As I propose for your consideration, the capital expenditures, Ministry Administration. Ms. Lawrence? Oh, Dr. Norton, sorry.
Mr. Chairman, under line item 6222, field materials and supplies, there's an increase of $15 million. Could the Honorable Minister explain this increase? Oh, sorry.
I'm going to put it back, further back, yeah, no. Page 443.
Other members, I'd like to propose, put the question that we approve the capital expenditure. Sorry, Mrs. Dr. Norton.
Project code 471, we're talking about 1704700, Ministry of Health building. Mr. Chairman, this completion of building is referred to as the completion of the high dependency unit. This the dependency unit is at the Georgetown Hospital. Could the Honorable Minister could say to us why this was not catered for in Georgetown Public Hospital?
Okay, well, that is a good question, and that is some of the anomalies probably the system. But this is the ministry from time to time. For example, later on you'll see where we are doing like the specialty hospital, like other things that we do, not in the regions. So this being done by the ministry because of its complexity and because of the cost and so on. So, but your question is, it does beg the answer, why do we do this? We can look at it, changing it, but for this budget, that's how it is.
On the same line, Mr. Chairman, we were told not so long ago that arrangements are being made for the extension of the CHI, which is the Caribbean Heart Institute. Here we are asking for money for the completion of the high dependency unit. Could the Honorable Minister tell this House if at the completion of this high dependency unit, if we will be having the high dependency unit in that sector that we complete?
Well,
I recall that question has come before. You may answer it out.
okay, well, this will be indeed, this is what it's aimed at. Remember the HSD is a fairly large area. And I told you we are taking some of the services out of that said building, taking them to the new wing that is being completed on the northern aspect of the property. This is where you'll be having the specialized equipment for the Caribbean Heart Institute, CHI, and that's why I spoke about the ICU being there too, because we'll be having expanded services from the CHI, which will be basically having access to that space we're speaking of.
Mr. Chairman, you said I asked this question before, quite rightly so. And I would have thought, having asked then we could have changed from the completion, the designation of this program. And rather than be, because the general public outside, when you explain to them, they expect to have an HDU, which is a high dependency unit, renovated, much more comfortable. Right now, where the high dependency unit is in the Georgetown Hospital, it is much more cumbersome than where it was before, which is now being renovated. We're being told now that it's no longer going to be the high dependency unit, and as a result, the ministers now say to us, why are they continuing the theme of renovation or extension of the high dependency unit?
Yeah, this is indeed a good observation, and we've done last year how these things are written. Because it was the high dependency unit, we keep referring to it. We need to change that. This is going to be given expanded. It just indicates where these activities will be taking part. In that building, for example, that part of the building which was called HSDU and still is, although those services are being withdrawn to another part of the compound. So we take note of that and desist or encourage people to desist from before them to the wrong nomenclature now.
Sorry.
This matter is entirely within the hands of the Minister of Education. And I think the discussion last year did suggest to the Minister that it's inappropriate to raise funds for one purpose and use it for something else. And in all senses, this infringes regulations. If the money is to be used for something other than the high dependency unit, it has to be requested with an appropriate title. I don't know that we can approve it when it is going to be used for something else.
Yeah, well, Mr. President, I think in figuring out the spaces we refer to do this, that is improved capacity of the CHI, which abuts just out of doorway out of this space. So this again is probably not taking the relevant note, adequate note of the comments of this discussion last year.
I'm sorry, Mr. Speaker, the question is not where the location, the space in which the money is going to be spent. The question is the functional purpose, and the functional purpose is not the high dependency unit. Money should not be requested on that basis.
Dr. Norton.
Mr. Chairman, last year, the minister came for an advance from the contingency funds for the period from August to November, and he sought supplementary provisions for roughly $31 million for this high dependency unit. However, the latest estimate at the end of 2013 was only $14.7 million. I just want to confirm that the balance from this $31 million from the minister was returned to the treasury.
Well, at the end of the year, this is the usual practice, and we can get confirmatory evidence of that.
And just to follow up, just for the minister to say that the $31 million still remains the cost for the high dependency, it hasn't changed.
Yeah, well, as we explained last year, this high dependency unit is that the spaces, again, this unit pointed out correctly, that it's being counted or promoted wrongly. It's not the HSDU, it is the space that is being used to expand the CHI, which is just a wall away, a wall separating it, a door separating it, so that we can, for example, put in specialized equipment. This HSDU, for example, having special walls. That's why it's costing so much money for that relatively small enclosure. So I do take the criticism that it should not be referred to as the HSDU unit, but probably the former HSDU unit, or just drop it and use the extended CHI or the enhanced CHI.
Ms. Selman.
And I think my technical people should also have to note these things.
Selma.
Thank you, Mr. Chairman. Mr. Chairman, project code 2404500. Could Honorable Minister indicate the type of vehicle to be purchased and also indicate where this vehicle will be assigned?
Okay, this is this is admin, the administration wing of the ministry. One. Chair, I was making another mistake. I kept saying HSDU. That's another section of it, it's HDU. So I,
Mr. Elman, you Ms. Ferguson?
Thank you very much, Mr. Chairman. Part of my question has been asked rather, or was asked by Dr. Norton. But let us go back to Project Code 120-1700. Last year, we would have voted or approved 168,000 or million, right? What I would like the Honorable Minister to do is more or less to provide this House with an update as to the amount of works completed thus far. Would you be in a position to do that, sir?
yeah, we definitely would be in a position.
And how soon?
Probably, I'll get it as soon as possible, but I don't want to put my foot in the mouth as it were. Why don't you give us until probably next Tuesday? Right?
Very well.
Honourable members, I'd like to put the question that we approve the capital expenditures for Program 471, Ministry of Health. Those in favor say aye. Those against say no. The ayes have it. These form part of the estimates. Turn your attention please to pages 180 and 181 as we consider disease control. Members, while we do so, I'd just like to say that we're taking note of ministers who are giving undertakings to supply information, and I know yesterday Minister Ramsamy did give undertakings for information that be supplied today, and I will be inquiring from time to time. Very well. Yeah, we understand that your information is on its way. Thank you. I was just saying that we're taking note as of yesterday, but I understand that you're in the process of making delivery. Thank you. I appreciate that. But Dr. Ramshan is compiling a very large list, so I just would like to say that we will be reminding you as the days go ahead.
Mr. Speaker, I want you to know that
Yes,
these
sir.
are not information directly which will be required.
Agreed. No, not.
Okay.
I appreciate that. It's not that you would have it's just information solicited after the questions. Members, are we ready for?
Mr. Chair, I could say this. We are
Yes.
open to these requests, even outside of this.
Well, I continue to encourage that in between budgets, members may approach their subject ministers and discuss with them, seek information, or formally put questions to the House. Disease control, I propose the question, Dr. Norton.
Thank you very much, Mr. Chairman. Under item 6224, could the Honorable Minister explain this princely sum of 50 million that has been increased on print and non-printable materials?
Okay, now this is an interesting point, and I'm happy, Mr. Chair, to indulge me to intervene. There's many foreign funded programs in the country over the past few years. Now, these programs are closing out in important areas of health like TB, HIV/AIDS, malaria. There is a transition. We now have to absorb certain costs, and a good perusal of this would find similar seemingly anomalies. For example, in staffing. We will have to take over now in the GOG budget some of those things which were in projects and international sources like GF Global Fund. And this, for example, ARVs, right? But we'll come to that probably. This year we're supposed to take over 25%. ARVs, antiretrovirals, are expensive. Then next year 50%. Then the next year 75%. And the next year the foreigners are gone and we got to take the board. So here, Dr. Norton, is where we have to take over all of that, the information, the educational work, the flyers, the statutory forms, to maintain these gains that we've made on certain programs.
Ms. Selman? Dr. Norton, go ahead.
Similarly, Mr. Chairman, under item 8222, would the Honorable Minister explain the increase of 15 million for field materials and supplies?
Okay, well, Dr. Norton, you'll notice that in a series of those, right? For example, from drugs and medical supplies, the one you just asked about, and this one. They're all connected because many of these programs are national, like the TB program, like the HIV/AIDS program, and other programs. And for example, in this same page, if you look at 6221, there's a hefty increase. That is the ARVs and the I mentioned, and the rapid test kits, which we will have to be taken over if we hope to maintain the level of rollback that we've had with such things like HIV/AIDS and TB and malaria. So you will see those few columns, entries, line items are significantly increasing. And this will be a repetitive answer in the next coming few budgets.
On the staffing details, 6116 contracted employees, you have an increase of 17 million for wages, 14 increased staff. Could you say what is the designation and the wages of the two highest paid?
Okay. This reflects the appointment of 14 office assistants, 2 stats clerks, 6 field assistants, medical officers, field assistants, including 5%. So we'll try to give you the two highest paid. Two highest paid would be medical officer and medical officer, both of whom received $227,946 per month each.
Dr. Norton, Dr. Cummings,
Thank you, Mr.
and Dr.
Chairman.
Meyer.
Line 96302, Honorable Minister, I noticed an increase in the allocation to that line item. I would like to know what is the nature of the training and who are the beneficiaries of such training?
Okay, first of all, the last question for the beneficiaries are persons existing employed in the service training, it's upgrades. And here again is reflected of the fact that we will have to be taking over more and more of those training programs to support strategies for some of these funded activities. In other words, the support from certain other budgets are being gradually withdrawn, and we have to wake up and smell the coffee and start getting the funds for these things.
Dr. Strong.
I have a question. 6111 administration. I noticed that there are 3 new positions filled or will be filled. Can you tell this House what will be the cost for the year for those 3 new positions that you move?
Well, I can tell you, while we try to calculate that, this is for the expenditure over this appointment of 3, that is 1 PDP supervisor, 1 admin manager, 1 director of communicable diseases, including the 5% increase. And I didn't calculate how much it was, but I suppose we can look at the data there. You can look at the difference of the number and you get a rough estimation of what it will cost to pay these 3 people in the new year.
Dr. Meyer.
Back to Mr. Chair. Mr. Minister, from 6231, item 6231,
Which number?
6231, fuel and lubricants. Can the Minister, Mr. Speaker, inform this House how many new vehicles will be purchased for this year?
Well, we will discuss that under capital.
We still current.
The question is, I have seen here from 2012, fuel and lubricants was $4.6 million. and the increase is approximately $4.4 million for them. So to consume this amount of fuel and lubricants, it has to be as twice the fleets that we're supposed to have at this time.
Give an explanation, Honorable Minister, as to the spike in cost of fuel.
Okay, okay, well, this is 412, then there's 413. I'm told that we also had included in this bill the generator, the NOx, the National Planning Secretary of them, the generator we are under this, and that is 200 tons. So that's why it changed from 2012 to 2013 significantly. Okay?
Thank you, Ms.
But I think we can look further. They might, I don't have my records here, what is the increase in the fleet. So you have budget or cost last year and additional details. But I don't have that information here. It's that will be discussed last year.
Ms. Marina Lowe.
Can it bring my right?